There is a growth of cells in the colon, which is part of the big intestine. This is colon cancer. The colon is the longest and first part of the large gut. Before the small intestine, there is the big intestine. During digestion, food is broken down so that the body can use it. People of any age can get colon cancer, but most people who get it are older. Polyps, which are small groups of cells, usually start to form inside the stomach. While most polyps aren't dangerous, some can turn into colon cancer over time. Polyps don't always show any signs. This is why doctors say you should get regular tests to check for polyps in the stomach. Colon cancer can be avoided by finding and getting rid of polyps. There are many treatments that can help reduce colon cancer if it happens. Some treatments are surgery, radiation therapy, and drugs like immunotherapy, chemotherapy, and targeted therapy. Cancer of the colon is also known as colorectal cancer. This word refers to both colon cancer and rectal cancer, which starts in the rectum. Signs and symptoms. A lot of people with colon cancer don't have any signs at first. What the signs are will probably depend on how big the cancer is and where it is in the large intestine. These things can be signs of colon cancer. A change in the way you go to the toilet, like having diarrhea or constipation more often. Bleeding in the rectal area or blood in the stool. Ongoing soreness in the belly area, such as cramps, gas or pain. A feeling that your bowels don't empty all the way when you go to the toilet. Feeling weak or worn out. Getting rid of weight without trying. What causes? Doctors aren't sure what makes most colon cancers happen. Gut cancer happens when the DNA of cells in the gut changes. The DNA in a cell has the directions for what to do. The changes tell the cells to make lots of copies of themselves quickly. The changes make it possible for the cells to keep living even after healthy cells naturally die. Too many cells are made this way. The cells could grow together to make a lump known as a tumor. The cells can get into good body tissue and kill it. The cells can split up and move to other parts of the body over time. Metastatic cancer is the name for cancer that has spread. Causes of risk. Some things that might make you more likely to get colon cancer are getting old. Anyone of any age can get colon cancer. But most people who have colon cancer are over 50. There are more and more people younger than 50 who have colon cancer. The doctors have no idea why. Black people. Colon cancer is more likely to happen to black people in the U.S. than to people of other races. Having had colon cancer or polyps in the past. Colon cancer is more likely to happen if you have had colon cancer or colon polyps. Having an inflammatory gut disease. Inflammatory bowel diseases, which make the intestines hurt and swell, can raise the risk of getting colon cancer. Ulcerative colitis and Crohn's disease are two of these conditions. Inherited conditions that raise the risk of colon cancer. Some changes in DNA that raise the chance of getting colon cancer tend to run in families. Lynch syndrome and familial adenomatous polyposis are the two most common inherited conditions that raise the chance of colon cancer. A history of colon cancer in the family. If you have a blood cousin with colon cancer, you are more likely to get it yourself. The chance goes up even more if you have more than one family member with colon or rectal cancer. Low fiber, high fat food plan. Eating like people do in the West might be linked to colon and prostate cancer. Most of the time, this kind of food is high in fat and calories and low in fiber. Different kinds of research have been done in this area. Some studies have shown that people who eat a lot of red meat and processed meat are more likely to get colon cancer. Not working out daily. Colon cancer is more likely to happen to people who don't do much. Being active on a daily basis might help lower the risk. Having diabetes. People who have diabetes or insulin resistance are more likely to get colon cancer. Being fat. Obese people are more likely to get colon cancer. Being overweight also makes you more likely to die of colon cancer. Using tobacco. Colon cancer is more likely to happen to people who smoke. Having drinks. Colon cancer risk can go up if you drink too much booze. Giving radiation to people with cancer. Radiation treatment to the abdomen to treat past cancers raises the risk of getting colon cancer. Colon cancer screening to keep it from happening. People who have an average risk of getting colon cancer should start getting screened for it around age 45, according to doctors. But people who are more likely to get cancer should think about getting screened sooner. People who have a history of colon cancer in their family are more likely to get it. To check for colon cancer, a number of different tests are used. Talk to your healthcare team about what you can do. Changes in how you live can lower your risk of getting colon cancer. The chance of getting colon cancer can go down by making changes to how you live your life. To make getting colon cancer less likely, eat a range of whole grains, fruits, and veggies. Vitamins, minerals, fiber, and antioxidants found in fruits, veggies, and whole grains may help keep you from getting cancer. So that you get a wide range of vitamins and nutrients, pick a range of fruits and veggies. If you do drink, do it in proportion. Women should not drink more than 1 drink a day, and guys should not drink more than 2 drinks a day. Don't smoke. Talk to the people who work with your health about how to quit. Most days of the week, work out. Every day, try to work out for at least 30 minutes. Start slowly and work your way up to 30 minutes if you haven't been active in a while. Also, before you start an exercise plan, talk to a healthcare expert. Stay at a good weight. Keep your weight steady by eating well and working out every day if you are at a healthy weight. If you want to lose weight in a good way, talk to your healthcare team. Slowly lose weight by cutting back on calories and getting more exercise. How to keep people with a high chance of colon cancer from getting it. The chance of getting colon polyps or colon cancer can go down with some meds. For example, regular use of aspirin or medicines like aspirin is linked to a lower chance of polyps and colon cancer. How much and for how long would need to be taken, though, in order to lower the risk of colon cancer? It's possible to get ulcers and stomach bleeds if you take aspirin every day. People who have a high chance of getting colon cancer are usually the only ones who can use these options. People with an average chance of colon cancer shouldn't be given these medicines because there isn't enough proof that they will help them. If there are things that make you more likely to get colon cancer, talk to your healthcare team about them to find out if preventative medicines are safe for you.